My name is Heidi and I will be presenting the description of our issue, our goal, and the purpose behind our change management project. For our change management project, we will be discussing how to improve price transparency at our imaging facility in order to increase patient awareness, patient satisfaction, and to promote patient engagement in healthcare decision making. As illustrated by the quote on this slide, we felt this is an important topic to discuss and important change to implement because by increasing cost transparency, patients are able to compare and contrast imaging options based on cost and value. Cost transparency also increases motivation to seek out alternatives, such as less costly imaging at another facility, determining if the diagnostic service is worthwhile for the patient's goals, and or considering an alternative imaging service that may be less costly but achieve the same goal. Cost transparency and patient education regarding imaging types, cost, and payment options is a critical part of working to reduce patient debt and healthcare spending. When there is a lack of cost transparency, patients may be overutilizing imaging services that are unnecessary or that could be completed in a more cost-effective manner. The goal of our change management project is to improve price transparency at our imaging facility in order to increase patient awareness, increase patient satisfaction, and to promote patient engagement in their healthcare. By increasing price transparency at our imaging facility, patient awareness will be increased because patients will be provided with information about the cost of the imaging service. Whereas prior to this change, patients would likely be unaware of the cost of our imaging services or would need to contact their insurance for cost information, as the bill would usually be sent to the insurance company instead of sent to the patient. Patient satisfaction will be increased through increased price transparency because those who are paying out of pocket instead of through insurance will be more aware of the costs and have easier access to cost and payment information. And last, patient engagement in healthcare decision making will be improved upon as patients will have increased access to cost information, which will allow patients to compare and contrast values and costs of imaging services. The purpose behind this change management project is to reduce patient debt and unnecessary healthcare spending, increase patient education and ability to compare and contrast options, increasing patient motivation to seek out less costly options, and to reduce unnecessary overutilization of imaging services. Overall, we hope to increase communication between the patient, imaging facility, and insurance companies, raise awareness, and stimulate patient participation in reducing healthcare spending and patient debt.
Hello everyone, my name is Riley and I will be touching base on the team members who will work in our clinic. The personnel involved will be one single biller coder, two patient representatives who will work together at the front desk and will be the first to discuss with patients regarding pricing in our clinic. There will be an office lead and a practice manager to help keep the flow of new information and clinical knowledge up to date. We will have one IT tech to help with any technological issues or questions that may arise with our staff members. Finally, in the clinical setting, we will have two radiologists, 4 X-ray techs, 2 ultrasound techs, and 1 MRI tech. The office lead and the manager will work together to create a cohesive administrative team that will meet on a weekly basis to provide answers to questions and brainstorm thoughts about the cost transparency website. Together, the team will practice how the system works and will role-play together on what to properly address to patients. It is important for our team members to feel comfortable speaking to a patient about any situation that may arise. The meetings will incorporate team-building exercises to help improve confidence in everyone because it can be rather intimidating talking with a patient about finances. The lead will be in close range to the front desk to help if they need any assistance with explanations. Before the office opens, the preparation for patients will be setting up the EHR, checking authorizations, having insurance input correctly, and prior practice on the correct speeches to say to be able to gain integrity and trust with their patients. If for any reason we run into computer problems, the IT tech will be on hand to help with any questions about glitches in the system. The tech can also help teach the staff how to keep up to date with any software change or tackling problems. Quarterly meetings will be held for evaluating everyone's comfort level with the cost transparency system. The staff can also discuss their thoughts about patient satisfaction and report back on what their patients have said to them about the website. A goal-setting system will be implemented for when the clinic hits a high attendance rating or a high patient satisfaction rating. If those goals are met and confirmed, possible incentives could be catered lunches, quarterly staff parties, small gift incentives, or a variety of other alternative incentives discussed by the staff. We believe a happy clinic will radiate positivity and integrity to our patients.
Okay, so this next slide is about the perceived barriers and challenges when we're telling patients about their bills or when we're quoting bills. So whenever a patient asks about their bills, it can be any time throughout their appointment. Most likely it'll be at the beginning or at the end of the appointment, so most likely it'll come up at the front desk. And when that happens, people will have questions. People always have questions about their bills, and it can take a long time to explain. And also, most likely, patients will have to be educated with their insurance, with deductibles, and other information when it comes to quoting bills. But that can be a problem with the front desk because it can create long lines. And it's not only for the front desk, but for the whole clinic. When we're discussing bills with patients at the front desk, it'll take longer, and if there's people behind the current patient that's asking about the bill, then those people will not be able to get checked in, and nurses and other staff members that are ready to take patients to the back won't be able to because they're not checked in yet. So it just kind of pushes the whole schedule back, and it creates more work for the staff members. Another issue that we could have with quoting bills is misunderstandings. When a patient asks about their bill at the beginning of the appointment, maybe at the front desk, it's possible that they'll have that quoted bill cemented in their minds. But sometimes if a patient needs something done or a service performed right away, or if this is what the doctor or nurse determines, maybe it's just an extra exam or test, those will tend to have extra cost and extra charges. And that will create an issue because the patients will already have a quoted bill in their mind, and they'll be surprised by the extra charges. So when they do get the extra charges, they just need to be informed that these services do have extra charges, and it will be different from their earlier quoted bills. Another issue that can arise is misquoting. If a staff member, not even just the front desk, but any staff member, if they're not informed about deductibles or they're not properly educated in it, then it's possible that they can give the wrong amount of charges to the patients. And that can create issues, which it's possible there are also patients that can see this service of the clinic being more transparent about the bill as a way to get more money. If they have a quoted bill and it doesn't end up like that, and exactly like that, then they can easily blame the clinic for it and try to get money from us for this service. Another issue that can arise is contract obligations. There are health plans that do not allow clinics to disclose the amount that charged to the patients for their services. So that can create issues if patients are asking about their bill and we're not allowed to tell them, then obviously they're not going to be happy about it. But yeah.
Measuring progress. So after each visit, a patient would get an email with a short link leading them to a questionnaire, a few questions that would just give the clinic an overview of how their stay was and how everything went. So questions could include such as, how did the check-in progress go? Was the lobby clean? Did your insurance cover your entire visit? Did it not? How was the staff? And so with that, if a patient did shut out a staff member, this would go towards an incentive program for the staff members. So if someone got 10 shout outs, they could get paid time off, free services at the clinic, a gift card of some sort, just to give the staff members an idea of how they are, treating their patients, and also give them a little boost of confidence, reassuring that they are doing a good job, and also give feedback on how things are going, if it's good or bad, things that they could work on. So even with that, they'd give the patients more of a chance to reevaluate their cost estimates and make sure that they're pricing their services at the right price and that they're in the right direction to ensure that their patients are getting the best care that they can get. Patient satisfaction. So with this survey, we do hope that our patients do recognize that we are taking the time to get their feedback and see what we can improve on. We hope that they appreciate it instead of making their visit, stressful and feel like we're putting a burden on them. We hope that this survey that it is successful, because it is giving us a chance to really take the feedback and apply it to the next steps in our service. And so we hope that we can rate the overall atmosphere, our patients, our services, our staff members, everything like that, just from the moment they come in to the moment they leave. Because patient satisfaction is so important to us, we hope that when they do return, that they feel like their feedback was taken into account and we did improve or maximize any strengths or weaknesses that were brought to our attention. So things like that will really give us an opportunity to excel as an overall practice and give our patients the best care that they deserve.
Hello, my name is Nataly Mejia. As you know, my team is trying to increase price transparency at our imaging facility because we know that at some point the number one question that is going to be asked is, how much is this going to cost me? But sadly, this question never gets an answer because of the complexity of each individual's healthcare plan. So when the patient then asks, why can't you provide me with a specific price? Well, the short answer is because multiple plans equals multiple reasons. Natalya is going to explain these multiple reasons next, but in the meantime, I'm going to focus on how patients will have easy access to getting their specific costs. Here is a list of Washington State's individual and self-employed health insurance carriers. Our goal is to have exam price estimates for all of these insurance companies for all diagnostic imaging modalities. Now, the process for how price transparency would work in our imaging facility is by providing patients with two brochures. The first brochure is to explain a little background information on how health insurance works along with exam price estimates. The second brochure is a step-by-step guide on how to find a patient's personalized price based on their insurance type. I will now hand it over to Natalya, where she will go in depth of how insurance works. Thank you.
So before me, Nataly explained how our patients could go about finding out the cost of their imaging exam based on their insurance type. She presented pamphlets that would go over all these steps. Now, the quick recap is there's an agreed upon price for exams between every healthcare facility and the insurance that it works with. For our organization, for example, the price may be higher with United Healthcare versus Aetna for a chest CT, but it may be lower with United Healthcare for a brain MRI. And We'll provide a platform similar to Metro Imaging for showing these prices. Now, the photo above shows the layout they're using. So the patients select their insurance carrier, the type of imaging they're referred for, and then they'll see a price come up, maybe with some variance, like with contrast or without contrast. The second part of that will be pamphlets that go into determining what the patient's actual out-of-pocket cost will be. Now, this is based on a couple factors, and this is the deductible and whether or not outpatient imaging is subject to that deductible, what the deductible amount is. For example, $500 for an individual's PPO plan or up to $4,000 for a family ABHP plan, how much of the deductible has been met. And then after that, we get into co-insurance, or the patient's responsibility versus the insurance responsibility. And I'll get into that later in a couple more slides. Now, and the reason that I'm explaining this is because what we saw a few minutes ago from the website, that will not determine the patient's actual out-of-pocket cost. And that's important to reiterate, because if patients are misquoted or think they're misquoted, they're a lot less likely to trust us. So it is nuanced on the website clearly, and we'll make sure that our patient access reps kind of repeat it, so they know that in order to find out their actual cost, they have to look at their individual plan benefits. So let's assume someone comes into us with a referral for a chest CT with contrast, and they'd like to know how much it'll cost. They've got Aetna, they did their homework and checked on our website and saw that between their insurance company and our facility, that type of exam is $450. But they also read the fine print and saw that this does not mean that that's their out-of-pocket cost or how much they'll owe exactly. So they'd like to know a more accurate estimate. So our PAC logs into Aetna's website and researches the patient's benefits and then can help break it down for him. Outpatient imaging is subject to the deductible with his plan, and he's met $300 of $500 of it. So the deductible is $500, and he's already had some medical care done that year and has met $300 of it. That means $200 is remaining. So he will owe that $200 of the $450 that the exam costs, and that'll go straight towards the deductible. Then there's $250 left. Now, after the deductible is met, outpatient imaging for his plan, the PAC finds, has 20% coinsurance. So again, $250 left from the cost of that exam. Insurance will cover 80%, which is $200, and then the patient covers 20%, which is $50. So the $200 from the deductible, the $50 from the coinsurance, that makes the patient's total out-of-pocket cost for a chest CT with contrast, with insurance, $250. And then I should also note that if he needs any more sort of outpatient procedures like imaging done for the remainder of the year, chances are he won't owe anything besides the 20% coinsurance, because he already met the deductible with this exam. And the other little nuance is it's really important for the benefit information to be up to date, because the website maybe might say that $300 of $500 has been met from the deductible, but the patient said that 2 days ago he had some other things done and he paid another $300. So in that case, the PAC should either call the insurance and verify, or simply trust the patient and quote him a price with only the $200 deductible. Just trying to say that updated benefits are really important. And this way, when we can give patients a printout of that information, I think our objective for price transparency is met, and hopefully our patients will be more comfortable scheduling their imaging through us. So how do patients find out their actual out-of-pocket cost? Well, the purpose of all this is to provide price transparency to them. We want to be able to give them a fairly accurate estimate of what they'll owe when they'll come in for that exam, and also explain how we got there. And they can get this information either when they come in or when they schedule the appointment. because it can be helpful. This way they might be able to make a more informed decision about whether they want to come to us or whether they want to look into a different facility, or maybe they'll decide that the exam isn't worth the time or the money. Because unfortunately in our culture it's not very rare for there to be over imaging or over testing prescribed. And so a couple of our staff will have rights and logins into the websites of all the insurance companies that we're contracted with, and they can look at the patient's specific plan information as well as their benefits usage. And not all the insurance companies will have particularly user-friendly websites, so some of them will have to just be called instead. But so the image above on the slide shows Aetna's provider portal, and most have something similar. And that's where the physicians or other front desk staff or financial representatives can log in and research the benefits or send in authorization requests.
In conclusion, our goal was to improve price transparency, to increase patient awareness, patient satisfaction, and promote patient engagement. With our solution, patients can compare and contrast imaging options effectively to be certain they are receiving the most cost-effective care available to them. We believe that communication between patient, caregiver, and insurance companies should be clear and easy. This is to eliminate any type of confusion or surprises with costs in the future. To streamline communication, it will take practice and coordination from the entire team. This is so that we can overcome obstacles like increased registration times or possible scheduling issues. It is important to us that patients are informed of any additional charges after their initial quote. Even if they have difficulty understanding why we had to increase the costs, we think that everything should be explained to them before they go any farther. We believe that monitoring patient satisfaction via surveys is going to be a crucial component towards ensuring market competitiveness and having all of the crucial feedback that patients can deliver to us to determine whether or not our services are valued within the clinic. Having on-demand access to specific costing information is not an easy task, but we believe that it is going to be worthwhile so we can offer patients exact quotes whenever they request for one. With this proposed system, quotes will be quick and accurate for a clear understanding of costs for services. This has been a presentation by Team Orcas. We hope you enjoyed it.